everyone, welcome to MEDICOZ Community. This is Dr. Ramya, your radiology educator. Today's topic is radiological findings in rickets and scurvy. So first, we'll see about the etiology. It is important to know the etiology of a disease so that it will be easy to remember the radiological findings. What is rickets? It is because of vitamin D deficiency, which causes failure of mineralization of bone and cartilage. So the causes for vitamin D is if there is any nutritional absorption deficiency in GI tract, or if there is a skin disease, liver disease, renal tubular acidosis. Why are we talking about skin and renal? This is because the vitamin D from the food goes to the GI tract, and even from the skin, it is converted into cholecalciferol and going into the liver, and it is finally converting into vitamin D in the kidney. So any skin, liver or kidney disease can cause vitamin D deficiency. So what are the radiological findings? It is divided into two: infantile rickets and adult. In infantile, 6 to 18 months of age, there will be growth plate abnormalities, especially in the long bones. The widened growth plate, that is, if it is more than 2 to 4 mm, then we have to think about rickets until proved otherwise. The loss of provisional zone of calcification is the earliest sign, which we'll be seeing in the pictures as well. The cupping of metaphysis, this is due to disorganized osteoid matrix that is deposited in the metaphysis. The bowing deformities of the bone. Why? Because these children will start crawling at this age, and there will be bowing deformities due to the weight. Delayed closure of fontanelles, softening of the cranial wall, that is called as craniotapes, rachitic rosary, enlargement of the cartilage at costogondal junctions. The vitamin D resistant rickets, that is generally presenting about more than 2 years of age, there will be only bowing of extremities, which is very marked, and bones appear sclerotic occasionally. So the above features are more prominent at the growth plates where the growth is greatest, that is at the knees, distal femur and proximal tibia, at the wrist, especially the ulna, and anterior rib ends, that is rachitic rosary. So overall, for the whole body, there will be protruding forehead, large head, and curved humerus, that is bowing of the long bones, and there is kyphosis in the spine. There is pigeon chest, depressed ribs, and protruding abdomen, curved radius and ulna, curved femur, and curved tibia. That is, the bowing of the ribs is the most important thing you have to see here. So because of the bowing, there is fractures and there are bands, and the classical cupping and widening of the growth plate is depicted in this graphic diagram. Now let us see the normal. This is the normal X-ray and this is a rickets. Here we are able to see the cupping and fraying of the metaphysis. This is another example. It is seen at the metaphysis. The metaphysis is showing cupping. That is the most important thing to identify. These are a few other examples for cupping and fraying. And this is an example for craniotapes. And this is the bowing of long bones on an X-ray. This is the costocondal thickening, which is showing a rachitic rosary appearance. So these are the classical findings for rickets. Coming to scurvy, deficiency of vitamin C impairs the ability of the connective tissue to produce collagen. That is, there is normal mineralization in this person. There is osteoporosis. So the most important thing is there is findings are most evident at the sites of rapid bone growth, just like in rickets. But the mineralization is normal, and there is decreased osteoblastic activity and cartilage proliferation, resulting in decreased formation of bone matrix. And this never occurs before 6 months of age because maternal stores have already transmitted to the fetus the necessary vitamin C. The radiological findings in children are generalized osteopenia, dense metaphyseal line, that is the Frankel, and Wimberger sign, dense epiphyseal rim, corner sign, metaphyseal fractures, Pelkian spur, periosteal reaction due to subperiosteal bleeding, hemarthrosis bleeding into joint, and in the adults we'll see osteopenia and pathologic fractures. So in the osteopenia is there, and the subperiosteal hemorrhage due to this is the periosteum line. This is the periosteum, and this is the hemorrhage surrounding it. And this is the white line of Frankel, which is very dense line, and the epiphysis shows a opaque line surrounding it, and there will also be hemarthrosis because there is bleeding tendency in scurvy. So this is the subperiosteal hemorrhage that you are able to appreciate here, and this is the scorbutic zone. This is the dense line of provisional calcification, that is the white line of Frankel. The lucent line just below the provisional zone of calcification is the Trummerfield zone. This is the ring epiphysis I was talking about, and this is the Pelkian spur at the metaphyseal tip. So these are the examples for you to remember better. This is the white line of Frankel, and this is the Trummerfield zone, the metaphyseal lucent band. These are other examples for metaphyseal spurs here. This is the metaphyseal spur. Thank you.